So you want to save money on Eliquis, right? Well, of course you do. Without insurance, this is one expensive medicine. It costs around $500 per month if you had to pay for it cash. But thankfully, you're smart. You have insurance. But still, it can be very expensive. Holy cow, you're at the pharmacy and they want how much per month? Well, the good news is that there are solutions for this problem. Eliquis is an important medicine, as are many medicines that are prescribed. Eliquis is one that doesn't make you feel better, but it helps prevent important events such as blood clots that can cause a stroke or cause a blockage in your lungs or lead to other problems in your body. So it's very important that if you have been prescribed Eliquis, that you do fill that prescription, find a way to do it, pay for it, and then look for ways to save money. And you're in the right place at Prescription Assistant because we're all about trying to help people save money on branded medicines for which there are no substitutes. You see, there is no generic for Eliquis currently available. Maybe in 5 years there will be. But as of today, you need to work with your insurance company in order to afford this medicine. But the secret sauce here is all about working with the company. Bristol Myers Squibb, in this case, offers savings programs for eligible patients. And the good news is that most patients are eligible. Now, eligibility really comes down to two major groups, whether you have commercial insurance or you have a form of government subsidized insurance. So the first group, commercial patients, are those patients that access their insurance through some sort of employer. So either you work and have insurance through your company or a member of your family carries that insurance. These patients can access the Eliquis copay savings program. It's a great program. And to find out about it, what you do is Google Eliquis, get to their website, and then scroll down to any area that you see about savings and support. So right at the bottom left, you can see that. And if we click on cost savings and support, it's going to bring us to their full information about their available programs. Eliquis 360 is what they brand this program as. And there's a phone number, 855-ELIQUIS, that you would call for more information. But the key really is getting a copay card. Once you have a copay card, your $40, $50, $90 prescription can be reduced to as little as $10 per month. And as it says here, for up to 24 months from activation. But don't worry about that, because after 24 months, the company will simply give you another card. So you can basically pay $10 indefinitely as long as you have commercial insurance. Now, what if you're in that other group where you have Medicare insurance? Unfortunately, laws in the U.S. prevent companies from offering patients with government subsidized insurance any kind of savings card. But what you can access, at least for the first 30 days of treatment, is a free trial offer card. And as it mentions here on the right-hand side, the Eliquis free trial offer card is available from your healthcare provider. And the same is true really for the copay card. So really there's two keys to success. Look to the company, the manufacturer, for discounts, and also work with your office. And really demand that your office find these resources for you. They prescribe the medicine, and they have these at their disposal if they work alongside the pharmaceutical companies to maintain a stock of these things. So really demand that they be working with their pharmaceutical representatives in order to make sure that they can help as many people as possible. Some doctors don't like to work with pharmaceutical companies, and unfortunately, their patients pay a lot more money for their medicines. But it doesn't have to be that way if we all advocate and ask our doctors to work with the pharmaceutical companies. Now, after 30 days, you might not still be able to afford your medicine if you have Medicare. And if you can prove that you cannot afford your medicine, the good news is that most pharmaceutical companies also have patient assistant foundations. And so this program through Bristol Myers Squibb, as it says here, that they provide certain Bristol Myers Squibb medicines to eligible patients free of charge. So this is a income-based program, but hey, you really need this medicine, And if you're in the situation where you do not have the income to pay for it, the good news is the company makes enough money off of these medicines that they can provide a lot of patients free medicine if they qualify. So no shame in applying and getting this information. But also, this is through the company, but there may also be resources at your state level. Perhaps if you visit your senior center in town, you might find about other programs that are available to you. The bottom line is that no patient should be able or should have a complete limitation of being able to get the medicines that they need, and a product like this is very important. As I mentioned earlier, if you've been prescribed Eliquis, don't stop taking it until you have the permission of your physician, and work hard to get it. Thank you. If you like this message, please press the like button and subscribe. And most importantly, share this message with anyone you know taking Eliquis.